welcome. You're watching Blueprint Exclusive and I'm Meghna Deka. Well, is paracetamol safe for you? Well, it's time to decode Trump's pill of paracetamol paranoia. That's right. Well, India has been gripped by a new kind of anxiety. It's the kind that strikes at the very heart of parenthood. Is an innocent-looking paracetamol, which is available everywhere, over the counter, at homes, is it safe for pregnant women, or will it possibly lead to autism in her future child? Well, this isn't merely a clinical debate. It's a deeply emotional whirlwind. And now that US President Donald Trump has linked the use of Tylenol or paracetamol, as it is more commonly used in India, during pregnancy to autism. Well, now this debate has exploded beyond the medical journals and it's landed right in our living rooms. So Trump says that expecting mothers should avoid it except in extreme cases. But major medical bodies, and this includes the Medical College of Obstetricians as well as Gynecologists, as well as UK's medicines regulator, they're all pushing back. They are saying that there is no credible proof of causation and that paracetamol remains the safest painkiller in pregnancy when it is used as directed by doctors. This is exactly what we are going to be breaking up and explaining to you. We're not going to depend on mere rhetoric. We are going to get you facts, we are going to get you proof, and we are going to get you two experts who are going to tell you what should be done, what shouldn't. In fact, Tylenol, the company itself has come out, and this is the statement that Tylenol has said. They said that there is no credible science behind the statement of Donald Trump, saying that facts remain unchanged. There's no proven link of Tylenol with autism. Meanwhile, the US FDA has now announced a safety label update to flag uncertainty, even as the doctors warn that misinformation could possibly push women towards riskier alternatives than paracetamol. But first, listen in to what US President Donald Trump has to say, his medical advice.
This country is going through what parts of the world are going through, and I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot.
No Tylenol, no autism? Does that really get borne out by the facts and medical data? But let's tell you the origins of Trump's contention. Now, this lies in a consensus statement which was put out by a group of scientists in 2021. Now, these investigations have suggested a correlation between prenatal exposure and an increased risk of autism spectrum disorder in the child. What does it say? Let's explain. There are three different stages that this 1991 consensus statement has broken down. They say when it comes to the prenatal stage, there is a possibility of male genital malformations in case there is too much of paracetamol. They also have cautioned that during childhood, there is a possibility of autism, ADHD, hyperactivity impact the IQ as well as language of the child. And then, when it comes to adolescence, even at that stage, could it possibly have an impact? They say that it may just lead to early puberty onset. Now, this, however, comes with a huge caveat. It's important for us to understand that while these studies undeniably raise pertinent questions, they come with this huge caveat, which says that correlation is not causation. That yes, indeed, they have found that they have happened, but does it mean that paracetamol is the one which has caused all of this? Well, for that, the study very clearly says that no, there is no direct cause that can be linked, but yes, there is a correlation. It's important for us to understand this point. Well, meanwhile, there is a vast landscape of other factors as well that could possibly cause neurodevelopmental trajectories. What are these? Let's tell you the ones which are specifically shown and which are specifically given. For example, there you have it. You have the genetics of parents. That is definitely one of the reasons, and as established by data as well. Another thing which may just cause autism in a child is the environment of the mother. Also, the lifestyle of the mother also could be one of the reasons which leads to autism. This is what already is borne out by medical facts. Meanwhile, there are numerous studies which are showing evidence of no link whatsoever to paracetamol at all. In fact, the chief amongst them is a huge study which is coming in just last year that included 2.5 million children in Sweden alone. And that's a huge number if you look at the sample size. The sample size itself is this whopping amount of 2.4 million births, this from the year 1995 to 2004. And what is the study, this research by the Swedish government says? They have said that there is no link of paracetamol use to autism. Paracetamol used by a mother cannot be linked, they say, to autism. Let's move on. Well, there's another statement which is coming in by the Autism Science Foundation right after the assertion which was made by President Trump. What is this statement saying? They say that this statement by President Trump is misleading. It is undermining public health. They have also said that such association is inconsistent with science, and families deserve more factual clarity when it comes to the use of paracetamol in pregnant women. Essentially, there's no scope for misinformation there. The only armor that you have is information, which is what we are giving to you. Let's tell you where the world really stands when it comes to the use of paracetamol for pregnant women. Well, in UK, it is approved by the NHS as well as the MHRA. It is also approved in European Union, this by the EMA. US also allows its use by the FDA. Of course, of late you've had that update which is coming in that it should be only in serious cases. Australia too allows it. It is approved by the TGA. In India, it is also approved by the CDSCO for usage in pregnant women. But why is paracetamol the first choice for doctors when it comes to pregnant women? It's important for us to understand what happens if a pregnant woman decides not to use paracetamol. Well, this is the reason. If this is a case of uncontrolled fever, it can be dangerous for the body, for the baby. If the mother is running very high fever, which must be controlled. Also, second reason, untreated fever or pain can pose risks to the child, to the unborn child as well in a pregnancy. Also, during a pregnancy, there are side effects such as high BP. All of this can also be detrimental to the child's welfare, to the child's growth. Also, it appears in breast milk after the baby is born, which is why it has been deemed that paracetamol is safe only in small quantities for pregnant and nursing mothers. Now, interestingly, there's a recent study which has found that nearly 1 in 8 Indian children, imagine 1 in every 8 children between the ages of 2 to 9 years may have a neurodevelopmental disorder. This includes hearing impairment, epilepsy, or even learning difficulties. At least 1 in 8 children suffer from this, which is why we are talking about it, which is why it is so very important that we have this conversation. But is there a business angle to Trump pushing against paracetamol? That's one of the big questions. Let's put it out here. 40% of US generic drugs are imported right here from India. Isn't that interesting? Also, let's tell you, the largest importer of paracetamol-like medicines is America. About 5.7% of the global pie of pharmaceuticals is right here in India. India is the one who's supplying at least 5.7% of the global pie. Also, and this is an interesting number, $55 billion is India's global pharma market. This is the amount that India is making out of the pharma as the pharmacy of world, as it is often called. So let me go across to our panelists and explain to you certain facts so that we rely only on facts and not rhetoric. Dr. S. Chatterjee is joining us, a senior consultant of internal medicine at Apollo Hospital. Dr. Meghna Deka is also joining us, Dr. Meghna Deka Nagpal, who's a senior gynecologist. I'm going to come across to you first, Dr. Nagpal, because it's important for us to understand. Right now, the conversations which are happening in many of the living rooms is not really based on medical science. What it is based on is highly emotional whirlwind that expecting parents have. Should a pregnant woman have a paracetamol, or will that hurt the baby? Tell us what the facts say. Tell us what the research says. Is it safe?
Thank you, Tanu, for having me on this show. You know, as a medical practitioner practicing in this field for almost more than 10 years, I would feel that it is imperative for the population to know that, you know, paracetamol is one drug which is the safest to be taken while you are pregnant, and it is the safest treatment available for fever. So if a pregnant woman contracts fever during pregnancy, her fever per se can give her complications like, you know, developmental defects of the baby, heart diseases, facial features can also get hampered due to an impending fever. So we have to tell our audience over here is, let's go by the facts and not by a statement which people not belonging to the medical background, medical fraternity, just pass on like that. This statements come from the fact that there were certain observational studies which were done long time back, where you know, these mothers who were affected with had a child affected with autism, they were made to fill these questionnaires, and these studies are more of a causative more of an association than a causative factor. So they are.
You must explain that a bit more, because it's important. That's an important point you are making. Dr. Nagpal, can you explain what's the difference between causational and a correlation?
Yeah, so basically they are, the mother already has a child affected with autism, and they are making them fill questionnaires that what all was hampered during their pregnancy. Did they get fever? Did they get a cough? Did they get diarrhea? Did they have any other medications apart from the regular folic acid and iron supplementation? And then they correlated that data to the percentage of people having autism. And that percentage was as low as 0.05%. So that is quite insignificant. Also, when they dug deeper in these studies, when they compared the sibling, these same mothers filled up the same questionnaire, and the sibling was not affected with autism. So that also gave us a clearer picture that they just associated having Tylenol during pregnancy to autism, but having Tylenol during pregnancy was not a cause of autism.
Absolutely, that's very well explained. Now, Dr. Chatterjee, you must explain to us, where does India stand when it comes to paracetamol? It's one of the most easily available drugs. It's over the counter, but now a lot of expecting parents are going to be gripped with paranoia. What's your advice to them? Should they be worried?
I think there is no reason to worry as of right now. We have been using paracetamol for so many years, and we have been actually recommending that use paracetamol if there is any problem in pregnancy, fever, body aches, headaches. Paracetamol has been found to be the safest medication. If paracetamol was that unsafe, by these many years that I have been practicing for 30 years now, by this time I would have seen all children would have been having autism, which is not the fact. If we even go by a clinical experience, where is that we do have autism, we have started recognizing autism much more than before because the way we have been trained now. But then where is the number? Because paracetamol is used by the gynecologists, by the pediatricians, by the physicians, everybody advises for paracetamol. We have learned during COVID days that people come out with such statements on just observational studies or a minute correlation, and they suggest medications not to be taken or to be taken. We should be more wise now that these type of observational or one correlational study doesn't make any difference. It has to be a lot of studies. It has to be proven that this medication causes a side effect. As of right now, my recommendation, and I am sure that most of the doctors would come out with this advice only, that paracetamol is still the safest medication for most of us.
One quick question, Dr. Chatterjee. Could there be other reasons, perhaps economic, financial reasons? Because we've heard about the medical lobbies and how they work and may just influence the kind of advice which is coming in from President Trump, who's no doctor. Dr. Chatterjee.
I'm not sure of that, but yes, I know about the medical lobbies that work hugely in the US, because the big medical lobbies which promote medications, and then they come out with statements which are against medication. Again, if we really go, we have a lot of clinical experience. Unfortunately or fortunately, in India, as doctors, we use a lot of our clinical experience in treating people. We do obviously keep a watch on the side effects and all that. But if we go by a clinical experience, a huge clinical experience that we all of us have, we have all seen that quite a few times statements are issued which actually are not factually correct, or they are not experimentally, they are not correct. Okay. So we have to be very careful in India, and we unfortunately we don't conduct that much of studies and all that. That's why we depend a lot on the Western world. But we have learned now not to believe them just like that, of whatever statements they make.
Well, absolutely. There may be reasons behind these Trumpisms. But at the end of it, you have two of the doctors, one of the leading ones in India, coming out and saying, yes, it is safe in smaller doses as per the doctor's precision. Not to pop it yourself, but go to the doctor. If advised by the doctors, it is safe even for pregnant women, even for nursing mothers. Do not fall for panic and the paranoia. It's important that you only rely on the proof. And this is what the proof has said. Thank you so much, Dr. Chatterjee, as well as Dr. Nagpal, for joining us here on the show. Hopefully, this clarifies a lot of the anxiety which has been whipped up across India now. With that, a short break. Don't go anywhere.